Jes Trygved, CEO of Cessatech, will join us today to give us some clarification on their news on December 22nd regarding top-line data from study 0205. But first of all, welcome, Jes.
Thank you very much. Thanks for having me.
So, first off, could you please give us a brief description of Cessatech?
Yeah. Cessatech is a biotech company with the purpose of developing approved medicine for children use, and we have been active now for almost 4 years. So still a young company in this industry.
What was the objective of this study and the outcome?
Yeah, study 0205, which we just presented just before Christmas, was a double-blinded placebo-controlled study in adults. And the objective was to show that CT-001 works well. And we had actually 4 arms. So a little bit complicated study with 4 different comparative arms. And I think we were very pleased with the results coming out that CT-001 is very effective. It has a good reduction in pain. But we also had the little challenge that we were not superior to all the arms. But luckily, when this was translated into children, which is our main target group, we clearly saw a very good efficacy in children. And of course, that's why we are happy with the results and very pleased that it works really well in children.
What can you tell us about the endpoints in this study?
Yeah, we had 2 endpoints in the study. First of all, efficacy, which is what I alluded to a little bit before, that you have both comparing them to other control arms, also a placebo, where they don't really get anything. Here we showed that we had a really good efficacy and was on par to one of the other arms. And then the second part of the primary endpoint was the exposure modeling, where we tried to take the results from the adult study and translate that into children using modeling, knowing that we have done trials before in children. And here we could clearly see that in children, the results were much better. And that simply has to do with the reason that the uptake in children is much different from what we see in adults. And that made us, of course, happy that CT-001 works really well in children.
This must, of course, be a very important milestone for Cessatech. Could you please elaborate a bit on what it actually means and what are the next steps?
Yeah, CT-001 is, of course, our lead candidate. This study was the biggest study we have performed so far. So we have spent nearly 1 year from start to end. It's going to have a huge impact on our filing. When you do the filing to EMA, it's, of course, a complete package. We are looking at both efficacy and safety. And the next step for us is to finish the last study 0202, and then, of course, initiate the regulatory process. So a very big milestone for us. We're very happy that we can come so far, and we still have a little bit of a way to go. But I think on behalf of the whole team, it's been a tremendous effort, and finalizing this study just before Christmas was a nice little Christmas gift.
Yeah, I'm sure it was. Could you just tell us a bit, what is the difference between treating adults versus children?
Yeah, this is an interesting area, of course, because the whole focus of our company and the guidelines from EMEA is, of course, to acknowledge that children and adults are not the same. So what we saw in this study was that the adults had a very different uptake compared to children. In children, we see a much higher exposure, 2 to 3 times higher compared to the adults of CT-001. And this basically means that the product works really well in children, but maybe not so well as we thought in adults. And of course, this was a little bit surprising to us. But it also confirmed the hypothesis that children and adults are not the same. And one of the reasons is probably that this is a nasal spray, and the uptake in children noses and adults noses are maybe a little different, or much more different than we anticipated. So going forward, of course, this also gives us some ideas on could we potentially do a formulation specifically for adults, and how would that do? But first of all, we'll focus on the children, which is our main purpose.
And what are your targets now for 2024?
Yeah, the first step is, of course, to understand the data a little more. We need to understand a little more why is there a big difference in adults and in the children. Then we need to initiate the study 0202, which is our last study in 150 children, which is more a safety study. We will initiate this study soon, and we also anticipate that the recruitment will be done this year, so we can initiate the regulatory process. And of course, this is when it becomes really interesting for us. Apart from that, we are a company that last year made an agreement with a US company. So we are going to focus on the US activities a lot this year. And in parallel, of course, also the European strategy in terms of commercialization. So it's going to be a very interesting year for us, and I'm sure we'll be very busy.
Yes, you have your partner Ventis in the US. Are you in active dialogue with the partners on other markets?
Yeah, this has been an ongoing process for us for the last 6 months. I think previously we have emphasized that US is extremely important for us, so that's why we were probably focusing a little more on the US setup, as many biotech companies do. We have a dialogue in Europe with several companies. We also have a little bit of dialogue in parts of the other world. So I expect this year also will be very interesting for a commercial partnership, at least in Europe. So I'm sure we will make a big noise whenever that happens, and hopefully it will happen this year also.
And where do you see Cessatech in 2029, in 5 years from now?
Yeah, that's a good question. It's not an easy market in terms of raising capital. So I think our focus now is really to get some commercial traction. We want to be a company, of course, that can develop more solutions for children. Short term, we want to focus on hopefully getting some income this year, which will be a major milestone for us. And then if everything goes well, we really would like to expand our pipeline. But first priority is definitely commercial activities. So 5 years from now, we are hopefully still a strong biotech company with more assets and more solutions for children that required our need and our support. So that's really our focus and hope for the company.
Okay, thank you so much, Jes, for sharing this with us.
Thank you very much. Have a nice day.